Welcome back. The country's continued efforts to address the diabetes crisis has intensified as a large number of beverages will now have a warning label for high sugar and artificial sweeteners. This comes after Wits University conducted a study of over 600 non-alcoholic beverages at SA South African retailers. To tell us more about the study and how it intends to address the obesity and diabetes crisis, I'm now joined by Dr. Siphiwe Dlamini, physiology lecturer at Wits University. Pardon me for that, Professor Dr. Dlamini. Dr. Dlamini, before we even get to the study as well, if you could please start by telling us how big of a challenge diabetes is in South Africa.
Thanks, Masa, for having me on your show. So diabetes is a major problem all over the world, but especially in South Africa, where we've seen that in many cases you'll find high prevalence of diabetes, especially among women and even men, especially the individuals who are of middle age and older individuals. So it is a major problem. It's a major problem because diabetes often leads to a number of non-communicable diseases, including diabetes and cardiovascular diseases, which cost a lot in our economy. So it's also linked to certain cancers as well. It's basically linked to almost all disease risk.
So with that being said, as well, you mentioned that mainly targeting middle-aged and older persons. Why that group in particular?
So it's an age-related condition. So the older you get, the more likely you are to become obese. But it doesn't mean that it doesn't occur in children and adolescents as well. So we've seen that over the years, there has been a rapid increase of childhood obesity, which is becoming a major problem now. This is it's increasingly prevalent because there are lots of changes in the environment. So we are seeing this steady increase in the occurrence of obesity because there are changes in the environment which are closely associated with urbanization. So rapid urbanization, which is occurring all over the world, but it's going to affect mostly developing countries. So urbanization often associates with risk factors for obesity and non-communicable diseases, including like eating unhealthy foods and being exposed to an unhealthy environment, especially the food environment.
And let's go back to the study that you conducted at Wits University as well, and tell us a little bit about the findings.
So basically what we did is we wanted, because we understand that there's this issue of obesity and non-communicable diseases in South Africa, and we understand that it's likely to become worse because of these changes that are occurring if there are no interventions that are being made. So the South African government also understands these important interventions. So that's why they've introduced several interventions, including more recently. What they did is they proposed amendments to the existing regulations when it comes to advertising and labeling of foodstuffs. So they within those regulations that they proposed, they also introduced or proposed introduction of mandatory warning labels. So these warning labels would be nutrient-specific labels that are going to assist the consumers in identifying healthy and unhealthy products. So what we did in the study, because we understand that sugar-sweetened beverages, they have been very much acknowledged in South Africa, especially within the South African context, to be contributing a lot to overweight and obesity. So we wanted to determine the proportion of these beverages that would require these warning labels, specifically focusing on two of the warning labels, high sugar content as well as the presence of artificial sweeteners. And what we found is that about half of the South African beverages would require these warning labels, at least half of them. So, but we specifically focused on drinks, on specific drinks like juices and soft carbonated drinks, as well as energy drinks. So we focused on those three types of drinks. And then we found that at least half of them would require these types of warning labels.
And with that finding that at least half of them would require these kinds of warning labels, what kind of hazard does that pose now to people who are consuming those kinds of beverages without knowing the amount of sugar intake in them?
So that's why these warning labels would be important in order to make sure that all the consumers, they understand what they are consuming. Because at the moment, what we have, the regulations that we have at the moment when it comes to prepared foodstuffs, especially the manufacturers are not mandated to provide the nutritional information unless a specific claim is made. So and what the guidelines what they have is that you should have the nutritional values as numbers, and we know that it's difficult to understand numbers and compare and understand whether a product is healthy or not based on numbers, because you would have to have some nutritional background in order to understand those values. So so for someone who, so unfortunately, if you don't have a background in biology or nutrition, you tend to be misled about how much sugar is in a product, because you can't rely on taste. Taste is often very misleading. So there has to be a way of knowing how much sugar is in there.
And speaking of that being misleading as well, of course, this will be law, and these companies will then have to put these labels on these beverages as well. But it's obviously also worked in their favor in some instances. How have the various stakeholders received this study as well?
I'm not sure how the manufacturers have received it yet. So the study was published about 10 days ago, so I'm not sure. But in terms of warning labels, the government proposed these warning labels, I think, in April 2023. So what they did is that they gave an opportunity for public comment, so that the manufacturers as well as the public can comment to say if they have any concerns about the warning labels. So at the moment, the government is still reviewing those comments to see the suggestions that have been made.
Yeah. And when it comes to alternative options as well, I mean, when you obviously conducted the study, it was also to highlight the problem and to educate South Africans about this too, and also to impact legislation. But did you also find that there are those who are thinking that they are opting for the healthier juice or whatever beverage that it may be? Meanwhile, back at the ranch, it is one of the most high sugar intense ones.
Yes, so within the South African context, the notion or the observation that juices had the highest sugar content is something that was expected. And this is because if you think about the history of sugar sweetened beverages in South Africa, you would realize that in 2018, there was introduction of the sugar tax. So the sugar tax, it basically, with all the other regulations that relate to sugar content, they basically focus on added sugar. So they focus on added sugar and then include the total sugar content. So when it comes to juices, like 100% juices, for example, they do not necessarily have added sugar. So the sugar comes, it's what they call naturally occurring, because it comes from, if it's a fruit juice, fruit juice, it comes from the fruit juice, the fruit itself. But when it comes to these other products, it's added sugar. So those products that have added sugar and have specified, have exceeded a specific cutoff point, they tend to be taxed via the sugar tax. But when it comes to juices, because the sugar is naturally occurring, that doesn't happen. So this is why now you are seeing that in South Africa, when you're comparing juices to other sweetened beverages, you'd find that juices have the highest sugar content. So in terms of the study, what we found and demonstrated was that, so the juices, even though they have high sugar content on an average of around 8%, so, but they are less likely to require the warning labels because the sugar is naturally occurring and it's not added. So because the regulations that have been proposed by the Department of Health, they also focus on added sugar rather than the total sugar content.
Makes sense. Thank you so much for helping us make sense of all of that and the study that you conducted at Wits University as well. That's Dr. Siphiwe Dlamini, who is from Wits University.